thank you so much, everyone, for coming. I think you all know I'm Denise Cumming from the University Hospitals Kingston Foundation. It is absolutely our pleasure to have the opportunity to connect our funders and our beneficiaries of the BMO Awards of Excellence. This is the inaugural group that have been selected to receive these wonderful awards. We are absolutely thrilled to have with us today our Regional Vice President for the bank, Mike DeGrace, and also Ron Canie, who is the Vice President Commercial for Kingston Rideau, which I assume takes you up to Ottawa as well.
Parts of Ottawa, yes.
Yeah. So we're going to dive right in. I should just introduce a few other folks who are here on behalf of the hospitals. Indira Lorraine and Janine Schweitzer joined with me and a couple of other folks on the selection committee, which was not as easy a task as you would imagine. There were a diverse array of applications in very different fields of study. So it was really hard for us to figure out a way to gauge them against each other, but Janine did an excellent process in leading us through that. We also have with us today Jen Goodwin, who is the Director of Communications and Strategy at Providence Care, and Cynthia Phillips, who is the Interim Director and Manager of Interprofessional Practice and Education at KGH. And I'm going to hand things over to Cynthia in a moment. I just want to take you back to a proud and wonderful moment in my career back in, I think it was 2007, when I had the opportunity to meet with Lloyd's predecessor.
Bruce?
Sorry, yes, I was going to have Mike's predecessor, Lloyd. I knew I was saying something incorrect about that. At the time, we were celebrating all kinds of wonderful occasions. It was a point at which we were very focused on celebrating or moving into a celebration of 150 years of the Sisters of Providence having provided wonderful service and care to this community. And when I sat down with Lloyd and said, you know, I understand that the bank has a way that they support capital campaigns, and of course we'll follow the rules. However, these three hospitals have been clients of your bank for an extremely long time. And he said, yes, I think one of them has bank account number 4 or something like that. And I said, you know, we have a wonderful heritage of leadership in healthcare in an interesting kind of environment. We're not a huge urban center, but we have a very focused and committed community that relies on us for care. We have this wonderful heritage that goes back more than 150 years. Do you think the bank would ever consider setting up an endowment that just recognizes this partnership that is so significant and historic for both the hospitals and the bank? And he said, absolutely not, we don't do endowments.
Good for Lloyd. And here we are today.
So I'm going to suggest that over time, Lloyd said, okay, we'll go and ask. And we were really pleased that the folks at the next level up in the organization took into account the very unusual and special nature of the relationship between the hospitals and the bank, and agreed to fund these awards in excellence. The intention of the awards from my conversation with Lloyd was recognizing that as a small urban center with a full range of tertiary care, we have a difficult time creating a level playing field for our very skilled caregivers and people involved in running the hospitals, having access to those unusual and very distinctive and high caliber training opportunities, because we're not a large center. And so the intention of the fund was really to help kind of level that playing field by focusing on employees who were going to be pursuing either graduate studies or training opportunities in highly specialized fields in other countries. And we are just thrilled with the applications that we had this year. At this point, I am going to hand things over to Cynthia, and she will just guide us through hearing from each of our recipients.
As healthcare providers and support staff, we strive to continuously improve the quality of patient care. This generous contribution will allow healthcare professionals from across the 3 organizations to have an opportunity to develop their knowledge and skills to the benefit of our patients, their families, and our community. This endowment opens up many opportunities that otherwise would not have been possible, and I'm sure everyone agrees with me. Many staff have a passion and drive for knowledge and are committed to continuing professional development, but do not necessarily have access to funding to further their educational endeavors. This endowment fund will help to make lifelong learning more accessible for them. The selection committee had some tough decisions to make based on the high quality of the applications we received. There was a great response to the call for submissions, and the committee reviewed a large number of applications and scored them based on the criteria set out by the Bank of Montreal. And I was looking through them again today, and they were truly impressive. I'm pleased to announce the first 4 recipients of these grants, who each received $2,000. Paul Kazarak is a social worker and the professional practice leader for social work at Providence Care. Paul attended the International Society for Interpersonal Psychotherapy Conference in London, England in June. Sabrina Gerd is a speech-language pathologist at Hotel Dieu Hospital. And Sabrina attended the fiber optic endoscopic evaluation training in Atlanta this past December. Sandy Fody is the coordinator of the ventilator equipment pool at Kingston General Hospital. And Sandy is getting ready to travel to Lyon, France this month to attend the International Conference on Home Mechanical Ventilation. And Ruhi Snyder. Ruhi is a registered polysomnographic sleep technologist at Kingston General Hospital. And Ruthie is going to Elsinore, Denmark in June to the 22nd Symposium on Shift Work. So those are all very outstanding educational opportunities. Excellence in education is happening because of the support of the Bank of Montreal. Words cannot express the appreciation the employees of KGH, HDH, and Providence Care have for your support. And on behalf of all of them, I would sincerely like to thank you.
Thank you very much. I'm absolutely thrilled to receive this award. So I will be going to conference in London, England in June. So 6th International Conference in Interpersonal Psychotherapy. So I work at Providence Care. I'm a social worker, but I work on a mood disorders outpatient service. We have 700 to 800 outpatients, very, very severe depressions. And the best treatment for this type of illness is a combination of medication and talking therapy, psychotherapy. So there are a couple evidence-based psychotherapies that are first-line treatments for depression, and interpersonal psychotherapy is one of them. Cognitive behavior therapy, many people have heard of that. That's the other one. We practice both of those on our service. So this conference is going to give me the opportunity to get together with people across the world, because the International Society is truly a worldwide organization. The conference goes back and forth between Europe and North America. A couple years ago, it was in Iowa City, so I was able to get in my car and drive there. But I just, there was no way I could have afforded to go to London, England, and it's very expensive, and so I'm absolutely thrilled. The conference will be 3 days, June 11th, 12th, and 13th, and I'll also be going to a pre-conference workshop day on the 10th. So thank you so much.
So I'm a speech pathologist. Thank you so much. This is incredible. This is really amazing. Thank you. Thank you so much for this opportunity. It's an incredible thing, I think. So in my role as a speech pathologist, I work across the sites. Actually, I work at Hotel Dieu, I work at KGH with inpatients, and I work at the Cancer Center. Part of my job, I see people for speech and language, but I also see them for swallowing, because all of this is, you use it for both functions. With our head and neck cancer patients, we use, currently we manage and assess and treat their swallowing using clinical evaluation and assessment and x-ray technology, and that's kind of how we see what's going on, see what's not working, or see what's working, and then see what we can do to improve it. The training that I was able to attend, I attended a workshop. It was a workshop conference in Atlanta, Georgia just last month. It was in laryngeal or voice box imaging. So using a tiny camera on the end of a tiny scope, sticking it through your nose and into your throat to see what's going on in there. And so I learned the skills to do that, and I learned I built up my knowledge base and skill set to interpret the imaging that you can get from that. As a result of that, I've started to implement that with our head and neck patients, with ideas later on for implementing it with outpatients here and then inpatients at KGH. Our patients, instead of relying on me to describe what's going on or exposing them to X-ray to come up with an image, they can just see it right on the screen. This is what's working, this is what's not. Try this out, oh that worked. Try this out, oh that didn't work, don't do that. And it's relatively safe, it's quick, it's easy, it's done in the same appointment. And patients tolerate it pretty well, as probably you guys can attest to. But I couldn't have done this without the support of you and the support of my teams. So thank you.
There you go. Fantastic.
Well, I have to say thank you. I'm so excited. I am going to Lyon, France. I know it's a hardship, but I'll do it.
I'm excited as well.
I'm going to the International Home Mechanical Ventilation Conference. This conference will bring world experts together, including, this is one of the only conferences that I attend that actually encourages and promotes patients and their caregivers to attend. And as we know, one of our philosophies is to include patients and be patient and family centered. So this certainly meets that mandate, and it's something I'm very, very strongly supportive of. So not only will it include the patients, it allows me to meet with scientists, leading experts, and I'll be able to bring that knowledge back and use it in my role as coordinator of the ventilator equipment pool. This is a unique program based out of Kingston General Hospital that provides home ventilators for the province of Ontario. So if you need ventilation at home, it's done through us at KGH. I am now adjudicating or approving the claims. I will be able to better determine what equipment is appropriate. I will be a resource, as I am now, but hopefully a better resource to the physicians, the patients, the families, and I hope to share that knowledge. We now have some new video conferencing equipment, and as Cynthia knows, I have been the clinical educator for respiratory therapy in my past role for 20 years. So I'm eager to share with all who want to listen, and even with those who don't. I plan to share it. So thank you very, very much.
Great, thank you.
I'm going to repeat it again. Thank you for this award. I'll be attending a conference, it's the 22nd International Symposium on Shift Work in Elsinore, Denmark. And its main theme is challenges and solutions for healthy working hours. Being a shift worker, I have first-hand experience of what the shift work can do to one's physical and mental well-being. So for the past 3.5 years, I've been conducting a self-case study, studying the effects of shift work, and most importantly, finding interventions that help mitigate some of the negative consequences. So this is the most fantastic opportunity because it fits in so well with what I have been working on, and it will give me knowledge, and I will have chance to speak with the world-renowned experts and gain insights. And most importantly, I think this award truly deepens my responsibility towards sharing this information and this knowledge with my fellow shift workers for hopefully a healthy and engaged life. So I'm very grateful. I'm very grateful to all of you. Thank you.
Great.
First of all, I just want to say really how touched I am, listening to all of you. It's one thing when you're looking at a piece of paper and there's an endowment fund, you look at all the technical pieces, but when you come here and you meet the people and you hear how passionate you are about what you're doing, And it sounds like a lot of giving back too. It's not just what this is going to do for you, but it's what you can do when you come back and what you can do for others. So, you know, at BMO we really are behind healthcare, and this is one way that we can support healthcare and education, because, you know, both of those things are here. So I'm just thrilled. I guess we'll call this bringing the human part of this to the table. We're seeing the faces and the people, and, you know, I can just picture all the lives that you're all going to touch. And as you were, you know, just sharing, I could just think of, you know, people in your own lives that, you know, might benefit from, you know, the journey that you've been on or you're going on. So thrilled to be here, thrilled to be able to support this great initiative, and congratulations to all of you. Just phenomenal.
Thank you. Thank you.
Yeah.
Just to echo some of Mike's comments, first of all, with respect to the endowment fund, you know, I think this is terrific. And, you know, if you look at, and I encourage everybody to pick up a Bank of Montreal annual report, and you'll see in the annual report we actually quantify the dollars that we put back into the communities as a corporation. And they're in the tens of millions of dollars, so it's extremely significant, and you know, and there is a purpose, and obviously today we're seeing that purpose with these recipients, and, you know, on a day-to-day basis as a commercial banker, you know, we deal with a cross-section and a multitude of vertical markets, and I must say we do have a very focused approach to the healthcare sector. It's, you know, it's one of our so-called top 3 sectors that we've identified, you know, from a commercial banking perspective, that we want to pursue, make greater inroads, and you know, it's simply because we look at demographics as well, and we can see that there is an aging population, and we can see, you know, other aspects of society developing that require all of these skills that have been presented today. And because of that, you know, we're very inspired. You know, this is very inspiring, actually. I've never had 4 people thank me in the same day as a banker. You know, generally it's been a little mixed in that case, but this is very inspiring, and I think the fact that we're able to export these individuals, so to speak, as you know, our international ambassadors to showcase, you know, the skill set that we've developed here in Canada with respect to the healthcare system. I think that's just fantastic. So again, congratulations to everybody, and we will look forward to actually maybe 10 recipients next year. Thank you.